Spring is here, and the deals are hotter than ever at Shack Shop. Turn heads with stunning bikinis, now on sale. Explore the deep with cutting-edge underwater drones. Gear up for adventure with durable tents for every trip. Ride into spring with unbeatable deals on bikes. Fresh styles, women's fashion, and must-have looks, all discounted. Don't miss the Shack Shop Spring Fling Sale. These prices won't last. Shop now and make this spring unforgettable, only at Shack Shop.
California fraud crackdown intensifies as $17 million Medi-Cal scheme ends in guilty plea. A sweeping federal fraud investigation has once again placed California under a national spotlight as authorities reveal the scale of a massive healthcare scam that drained hundreds of millions from taxpayer-funded programs. The case centers on a Southern California man who admitted to orchestrating an elaborate billing scheme that exploited loopholes in the state's Medicaid system, raising broader concerns about systemic vulnerabilities and oversight failures. A massive fraud scheme comes to light. Federal prosecutors announced that Paul Richard Randall, a 66-year-old resident of Orange County, pleaded guilty to wire fraud after authorities uncovered a years-long operation that siphoned enormous sums from Medi-Cal, California's Medicaid program. According to investigators, Randall and his associates billed Medi-Cal more than $269 million for prescription drugs that were either unnecessary, never provided, or deliberately misrepresented. Of that amount, approximately $178 million was actually paid out, funds that ultimately came from taxpayers. The scale of the fraud has alarmed officials and watchdogs alike, highlighting what many see as a troubling pattern of exploitation within public healthcare systems. How the scheme worked. At the core of the operation was a temporary policy adjustment within Medi-Cal. During a certain period, the program relaxed its pre-authorization requirements for specific medications, an administrative change intended to streamline care and improve patient access. Instead, prosecutors say, Randall turned that flexibility into an opportunity. Using a pharmacy under his control, Randall allegedly submitted claims for 19 different high-cost medications. While these drugs were billed as expensive specialty treatments, they were in reality composed largely of low-cost generic ingredients. In many cases, the prescriptions were medically unnecessary or never dispensed at all. By repeatedly billing for these drugs without the usual oversight checks, the operation generated millions in reimbursements every month. Laundering the profits. Authorities say the scheme didn't stop at fraudulent billing. Randall and his co-conspirators allegedly went to significant lengths to conceal their activities and distribute their profits. Funds obtained through Medi-Cal reimbursements were funneled through third-party entities in a complex money laundering operation. These transactions were designed to obscure the origin of the funds while enabling kickbacks to collaborators involved in sustaining a fraud. This network of financial transfers allowed the scheme to continue undetected for an extended period, further amplifying the total losses. Federal response and strong warnings. Federal officials have responded forcefully to the case, emphasizing that healthcare fraud remains a top enforcement priority. First Assistant U.S. Attorney Bill Asaley described the misconduct in stark terms, stating that Randall treated a public health program as his personal piggy bank. He added that the guilty plea should serve as a warning that authorities are intensifying efforts to hold fraudsters accountable. Randall now faces a potential sentence of up to 30 years in federal prison, with sentencing scheduled for later this year. The case aligns with broader national efforts to combat fraud in government programs, particularly as officials warn that billions of dollars may be lost annually due to improper payments and criminal schemes. Growing focus on California. In recent months, California has become a focal point in the national conversation about fraud. Federal initiatives, including task forces aimed at identifying large-scale abuse, have highlighted the state as an area of concern. A task force associated with Vice President J.D. Vance recently pointed to a surge in enforcement actions targeting healthcare providers across California. These actions include suspensions, audits, and criminal investigations into suspected fraudulent activity. In another major enforcement effort, authorities launched a Southern California crackdown known as Operation Never Say Die. That operation resulted in multiple arrests and charges connected to a separate $60 million Medicare fraud scheme, further underscoring the breadth of the issue. Political reactions and public debate. The case has sparked widespread discussion across political and public spheres, with officials and commentators weighing in on what it reveals about government oversight. Critics argue that the sheer scale of the fraud points to systemic weaknesses, particularly in how claims are verified and payments are processed. Some have questioned how such large sums could be approved and dispersed without triggering earlier intervention. Others have pointed to outdated systems and insufficient safeguards, including reliance on self-reported data and limited real-time verification mechanisms. At the same time, state leaders have pushed back against criticism, emphasizing California's efforts to combat fraud and strengthen accountability. A spokesperson for Governor Gavin Newsom highlighted that the fraud was initially detected by state officials and referred for federal prosecution. The statement underscored ongoing collaboration between state and federal agencies in identifying and addressing fraudulent activity. California's defense: progress on fraud prevention. State officials maintain that California has made significant progress in reducing fraud and improving oversight. According to figures released by the governor's office, the state has prevented more than $125 billion in fraudulent payments, arrested over 1,200 individuals tied to fraud schemes, reduced EBT-related fraud by 83% within a year, implemented a ban on new hospice licenses beginning in 2022 to curb abuse. Officials argue that these measures demonstrate California's leadership in tackling fraud and protecting public resources. Ongoing challenges in healthcare fraud. Despite these efforts, experts say the Randall case highlights ongoing vulnerabilities in large-scale public programs. Healthcare systems like Medi-Cal and Medicare process enormous volumes of claims daily, making them attractive targets for fraud. Temporary policy changes, such as relaxed authorization rules, can further increase risk if not paired with robust monitoring systems. Key challenges include limited real-time verification of claims, heavy reliance on provider-submitted information, inconsistent auditing practices, daily delays in identifying suspicious billing patterns. Addressing these issues often requires significant investment in technology, data analytics, and interagency coordination. Calls for reform. In the wake of the case, some experts and industry leaders are calling for a shift toward prevention rather than reaction. Suggested reforms include enhanced identity verification systems, real-time analytics to flag unusual billing patterns, increased use of third-party audits, improved coordination between state and federal agencies. The goal, advocates say, is to stop fraudulent payments before they occur, rather than recovering funds after the fact, which can be far more difficult. A broader national issue. While California has been in the spotlight, fraud in public programs is a national concern. Similar schemes have been uncovered across the country, involving everything from telemedicine fraud to durable medical equipment scams. The creation of specialized enforcement units within the Department of Justice reflects the growing urgency of the issue. Officials have signaled that aggressive investigations and prosecutions will continue as part of a broader strategy to protect taxpayer funds. What comes next? As Randall awaits sentencing, the case serves as a high-profile example of both the risks and consequences associated with large-scale fraud. Authorities say the investigation remains ongoing, with the possibility of additional charges or related cases emerging. For policymakers, the case raises important questions about how to balance accessibility in public healthcare programs with the need for strong oversight. For taxpayers, it reinforces concerns about how public funds are managed and how easily systems can be exploited when safeguards fall short.